Good evening and great evening. We just bring you greetings from the Norbeck Community Church under the banner of Norbeck Works for You. Norbeck Works for You. It's part of our community effort to really engage men of color, black and brown men, and those men who are impacted by our local ministry and community. We are not segregationists nor isolationists. We welcome all. But at this time, we're really focusing on Black and Brown men's health. Black and Brown men's health. We're delighted to be in partnership with the Black Physicians Network in Montgomery County, along with various and assorted other groups that are sharing their interesting, innovative, and invigorating uh, efforts to increase awareness around the issues impacting and affecting our community and Black men in particular. Now, when we talk about the impact on Black men, we also talk about the impact on the families of the diaspora. And so it's not just men alone, but it's all who men partner with in life: families, wives, children, partners, all who represent us and we represent them. So what we're going to do is take a minute to give folks another opportunity to tune in as we're sharing this on several social media platforms, and then we'll get our program started tonight. We're delighted to have with us Dr. Benita Cole, MD, MBA, who will share with us some helpful hints as it relates to prostate care. And then also Dr. Akmal. We try to do it all. We'll look at health and wellness from a holistic approach. There's some very innovative ways to treat and to prevent and to accompany those of us who have some physical, emotional, social challenges. So sit back, give us 3 minutes, and we'll be right back. You here? We have two amazing presenters tonight. Thank you for joining us. Last week we had young Miguel Davis who walked us through a couple yoga stretches and breathing exercises. He actually gave us a whole yoga routine. We're excited about what he was able to provide. You can find him on Instagram at Miguel Davis. He is a yoga practitioner. He is an artist by training, graduate from our university, College of Fine Arts. He is a painter. He is a swim coach in high school, and we're just excited about what he showed us. And then Anthony Grigsby, aka Deacon G, who helped share with us some of his remedies as he had been impacted by COPD to increase lung capacity, doing Tai Chi, and what his daily ritual was using Tai Chi to help his circulation, his meditation, to be a part of increasing his respiration, even his flexibility as a senior adult, still actively moving. And in that same vein, tonight we're excited to have two healthcare practitioners, traditional medicines, and traditional medicines to share with us ways that men can help it, be active participants in their own care. We're doing this tonight as part of the Black Physicians Health Network in Montgomery County, along with more than 30 other partners tackling Black and Brown men of the diaspora and the Caribbean, healthcare concerns that impact our community. We're getting ready for our Brother You Are On My Mind 6 week cohort to come in the spring, where we will have six cohorts made of 6 men for 6 weeks, and we will use some of these practices in order to check on one another and to support one another in both our physical, mental, and emotional health. You might think it's strange that this is what the church is doing, but we believe in the ministry to the whole body. It's the foundation for mind, body, and soul. Uh, the Jesuits encompass it as a part of their ministry formulation, ministering to the whole person. And that's why we're here tonight. So sit back, see it. You can find us on YouTube. You can find us on Instagram. You can find us on Facebook, and even some snippets you can find on TikTok. So check us out on our socials, Norbeck Community Church or Norbeck Church. You can see my page, Courtney Miller, and see the great works that we're doing here in ministry. Tonight, we're delighted to have a internist, Dr. Benita Cole. I'll let her introduce herself, but I've seen her presentation on a Sunday night as a part of the Omega Psi Phi fraternity's weekly worship service. That's right, we made physical health an integral part of our emotional and spiritual health journey. And her presentation to a group of men was jaw dropping, to say the least. So we're going to give her the camera and let her do her own thing. But first, I want to ask her a question because she's doing medicine in a non-traditional but traditional way that I am completely and totally fascinated by. Dr. Cole, what led you, and can you describe your practice and your practice of medicine right now?
What I'm currently doing now.
Yes, ma'am.
So currently, I am doing telemedicine. I am doing cancer screening and cancer prevention. And so this topic that I will be doing tonight is what I do every day. As far as my philosophy in practicing medicine, I feel that people need information and people need to be empowered to be advocates for their own health so they can be better partners with their doctor and to get better health outcomes.
That thank you. That's kind of what I wanted to get at. The telehealth part, the partnership part, and giving or at least sharing some skills that can help us be better partners in our own care. And with that said, I turn the comms over to you and you have at it. Hit us with your best shot.
So thank you, Reverend Miller, for having me back again. Um, you are a glutton for more punishment. And so I am going to get started by sharing my screen here. I'm going to share my screen and get started with my presentation. And so my name is Dr. Benita Coe, as Reverend Miller said. I'm an internal medicine physician, and as Reverend Miller alluded to, and as I alluded to, I wrote a book that was released in November of 2024. It's called How to Help Your Doctor Help You, a guide for men and women to manage health proactively. And I wrote all about my philosophy, and I get into details about how to be a better partner with your doctor to manage your health and have better health outcomes. And before I get started, I always like to have a information at the beginning of presentations to let people know that I'm giving information, but it's not to replace any recommendations that your doctors give you, and that you should consult your own medical professionals before making any changes in the care that you give. And so on this topic of prostate cancer screening, I actually wrote a monthly newsletter, as I typically do every month, on prostate cancer screening. And so there's a QR code that you can go directly to that particular newsletter, and you can find all of my monthly newsletters that I've been writing since October 2023 on my website, besthealthforyourlife.com. And so much of what I'm talking about this evening with respect to prostate cancer screening is detailed, and I have even more details and more links and rabbit holes that you can go down on in this newsletter. So let's jump in and get started. And just like before, I'm going to use anatomical terms and we're going to use big people words. So let's not be squeamish about the body part that we are talking about. So tonight we are talking about male anatomy and the prostate gland. And this is the prostate gland here that I hope you are seeing the arrow here. The prostate gland is a small gland beneath the bladder. And this tube here is the tube, it's called the urethra, that comes from the bladder, and that drains semen and urine. It goes out through the penis. And so this to the right here is a frontal picture of the urinary tract in a man. You have your kidneys here, the ureters that drain urine from the kidneys. There's the bladder. There's the little prostate gland, and there's the penis and the testicles on the side. So this is the part of the body that we are talking about. And so what does the prostate gland do? The prostate gland, even though it's a small gland, it really is very important. It's an organ in biological males, as I showed you, located under the bladder. It produces fluid that gets added to semen. It actually does have muscles that pushes fluid through the urethra. That's the tube that allows urine to leave the body. It also allows semen to leave the body during ejaculation. It contributes that fluid and to what we call ejaculate. And I gave the definition of what ejaculate is. That's the fluid that is released from the penis with orgasm. And that fluid contains a lot of substances like enzymes, zinc, and citric acid. It helps nourish the sperm cells and lubricate the urethra. And it helps all those fluids leave the body through the penis. And so that is what the prostate gland does. And so I put this one slide into the presentation just to illuminate the importance of prostate cancer in Black males in the United States. Prostate cancer is diagnosed every 13 minutes in the United States, and Black males die every 80, one man dies every 87 minutes. That's what that calculates to. So this graphic here, this comes from Zero Prostate Cancer, a very important organization that actually headquarters are in Alexandria, Virginia, in Northern Virginia, in this area. Just some statistics about how important prostate cancer and this condition, this disease is, and how important it is to find prostate cancer early, which we will talk about as far as prostate cancer screening and finding prostate cancer early, so we can deal with it. And so you may ask, what are some symptoms of prostate cancer? Well, the truth of the matter is that early prostate cancer, when you want to find prostate cancer, often has no symptoms. But this list here are symptoms that can be a sign of prostate cancer. But as you can see, many of these symptoms can be symptoms of something else, like a change in your urine flow, pain in the area of the prostate gland, change in your urinating habits, also change in your bowel habits, pain with ejaculation or orgasm, change in how you're having erections, seeing blood in your urine, blood in your semen, and also symptoms that are not necessarily related to the urinary tract, like low back pain, hip pain, and chest pain. If prostate cancer, if it moves beyond the prostate gland, it can go to the bones and cause those kind of symptoms. If it goes to the spine, you can have numbness in the legs or feet. So many of these symptoms can be related to something else. And the bottom line is, if you have any new symptoms that you don't have an explanation for, you should not wait. You should not ignore them. You should not think they're going to go away. You should not be afraid to get them evaluated by your doctor or seek medical attention at a local clinic or call your local health department if you don't have insurance to find out where you can get medical evaluation. But keep in mind, the reason why it's so important to do prostate cancer screening is that prostate cancer often has no symptoms at all. And so, how do you do prostate cancer screening? The primary way to do prostate cancer screening is with a PSA blood test. You may have heard of this. PSA stands for prostate specific antigen. It is a protein that is made in the prostate gland, and this PSA protein is measured in a sample of blood. So it does require collecting blood. So it is a blood test that a doctor has to order for you, keeping in mind that there are other conditions that can raise the level of a PSA. So if you have a PSA done and it's high, then that means you need further evaluation to see the cause of the elevated PSA, to see if it's prostate cancer or it could be something else. So it doesn't necessarily mean that there is a cancer. And so the other part of doing prostate cancer screening is what we call the digital rectal exam. Digital means finger. So in this picture, this is as if your body is cut in half. And so this shows the doctor's gloved finger in the rectum. And so by putting your finger in the rectum, you can feel the back of the prostate gland. And so for many men, this is also recommended as a part of the prostate cancer screening because prostate cancers can be felt by doing this type of exam. But as you can see in this picture, when you're doing a digital rectal exam, you're only feeling the back of the prostate gland. You're not feeling the whole gland. So doing a digital rectal exam alone is not enough to do prostate cancer screening by itself. It should be done in conjunction with doing a PSA. So, after knowing how you do prostate cancer screening, the question is why a lot of times Black men decline getting screening. There's a lot of fear, misinformation about why Black men are not getting screening. A lot of men are embarrassed about getting a digital rectal exam. They may think that screening is only for if you have symptoms, not being aware that you can have prostate cancer and not have any symptoms. Many people think, oh, I don't need to be screened if nobody in my family has prostate cancer, which is not true. And I need to make a point here that is very important to know your family history, because that is how you know about your risk for prostate cancer. And the risk, you can have increased risk of prostate cancer if you have men in your family that have prostate cancer. But just because you don't have men in your family with prostate cancer does not mean that you cannot get prostate cancer. Many men may not be aware of how common prostate cancer is, may not be aware of how to do prostate cancer, what the testing methods are, when they should start. Very often, people are often fearful of getting a serious diagnosis, so they avoid screening. And also, it's not just always on the man himself. It also can be on the doctor not ordering the test, not discussing it. with the patient. That also is happening. And so that's why doing sessions like this is very helpful, so you can advocate for yourself and insist that your doctor does the appropriate testing for you at the right time, which we will get to. And that is the next slide. At what age should you start doing prostate cancer screening, meaning getting that PSA, getting that digital rectal exam, if that is recommended for you? Is it age 50? Is it age 45? Is it at age 40 for African American men? And so that is why it's very important to talk to your doctor about your risk. African American men have increased risk, talking about your family history, talking about any genetic history that you have, and you and your doctor can make that decision about when you should start getting prostate cancer screening. Men who have average risk for prostate cancer, we say should start at age 50. But African American men are not at average risk, because African American men already have an increased risk and should at least start by age 45, but sometimes even age 40, which I will go through in the next slide. So there are two societies that we use for guidance in deciding about when prostate cancer screening should start for men, and particularly African American men. That's the American Cancer Society and also the National Comprehensive Cancer Network. And so the American Cancer Society recommends starting at age 50 for average risk men, as I stated. They recommend starting at age 45 for African American men, or if you have a first degree relative. So first degree relative is parent, child, or sibling who has prostate cancer, and even going younger at age 40, if you have any genetic illness, genetic conditions in yourself or your family where prostate cancer screening should be done even sooner. So this you need to discuss with your doctor. So when I talk about genetic risk, I'm talking about genetic mutations that increase the risk for prostate cancer. And so the National Comprehensive Cancer Network recommends starting at age 45 for average risk individuals, and they recommend starting at age 40 for African American men and for people who have genetic mutations. So these two societies have different recommendations about when Black men should start. So American Cancer Society says 45. National Comprehensive Cancer Network says age 40. Where I work, we say age 40. In general, we say age 40. And this slide comes from the National Comprehensive Cancer Network, gives more information about what to do with your PSA once you get your test results. Meaning that if your PSA result is less than 1, the recommendation is you can retest every 2 to 4 years. If it's between 1 and 3, you can repeat every 1 to 2 years. But and so you can take a look at that. But for African American men, I recommend getting a PSA every year starting at age 40. Remember, guidelines, this is what I tell my patients, guidelines are just that, guidelines. With my patients, I start at age 40 and I do it every year, regardless of the PSA test result. The current guidelines are to stop prostate cancer screening at age 75, depending on the health of the man and his how long he's expected to live. But that's something that also needs to be discussed with your doctor about when to stop prostate cancer screening. The next slide is another Society, the Prostate Cancer Foundation also has their own guidelines, and they also recommend Black men start screening between age 40 to 45. But if you look at number 6, they also put the recommendation to consider screening starting as early as age 40. So the answer to that question that I asked a couple of slides ago, I really like to get started with screening for Black men, African American men, starting at age 40, regardless of family history. But that is something that you definitely should discuss with your doctor about when you want to start your screening. So that is about prostate cancer screening. And I put this slide in here because a lot of men have a lot of questions about the prostate biopsy. And the issue is once that PSA or prostate specific antigen is abnormal, the next step, if it comes to that, is actually getting a piece of tissue from the prostate gland and sending it to the lab. So all this video shows is how that piece of, this is just a YouTube video, and all that video shows is how the tissue is obtained from the prostate gland. So a lot of times that prostate biopsy is done by ultrasound. It is can be done from the back. It can be done from the front. There's a lot of different ways that biopsy is obtained, but basically, in some form or fashion, a piece of prostate tissue has to be obtained to get a final diagnosis of prostate cancer. And so you have prostate cancer screening done whether you have symptoms or not. You've decided to do the screening. And you have your PSA blood test, but stepping back, what can you do to decrease your risk of prostate cancer? And here's a long list of things. And actually, this list of things actually is a list of ways to decrease cancer risk in general. And these are basic things that we all should be doing anyway to have optimal health. But the big things as far as cancer risk reduction is avoiding processed meat. So that's the bacon, sausage, ham, cold cuts, deli meats, hot dogs. And I tried to list everything that I could think of that we all eat, that we all need to stop eating. The other thing is getting rid of red meat. So that's beef, meat from a cow. That's also lamb, also deer meat for people who eat that, because we now have more definitive evidence that red meat increases the risk of cancer. And so that means as far as cancer risk reduction, and specifically today talking about prostate cancer risk, it is very helpful to eat more fruits and vegetables and focus on plant-based eating. Not that you have to become vegan or vegetarian, but I will go as far as to say that you don't have to have meat at every meal. So focus on low-fat eating, of course, avoiding fried foods, high sugar and processed foods. Getting regular exercise goes a long way to reducing prostate cancer risk. Losing weight if you're overweight or obese. Obviously, quitting smoking if you smoke. We've known for a long time, we have more definitive evidence now that alcohol, including beer, increases the risk of cancer, all cancers. We've known for a long time that red meat and processed meat increases the risk of cancer. We've known for a long time that fruits and vegetables decreases the risk of cancer. And also if you have high blood pressure, diabetes or pre-diabetes, so you have glucose or sugar issues, and high cholesterol, getting that under control, decrease the risk of prostate cancer. And also, which sounds like we're going to be talking about next, minimizing stress, that also decreases the risk of prostate cancer. And so, in closing, when we're talking about whether you're going to do prostate cancer screening, I encourage you to ask yourself these questions. Are you at high risk for prostate cancer? Who has what cancers in your family? And not just prostate cancer, because there are other cancers, familial genetic type cancers that can go along with prostate cancer syndromes. So it's very important to discuss all the cancers in your family, especially parents, children, siblings, grandparents, and even first cousins, and give that information to your doctor. Also, how do you feel about the possibility of getting a false positive result? Because any kind of testing can give you a false positive result, and a positive result should be acted upon, but sometimes a result ends up meaning that you don't have the condition that the test is looking for. And so you have to know your comfort with that possibility anytime you're doing any type of testing. And you have to say to yourself, are you willing to have a prostate biopsy if, in fact, that is a recommendation after you have prostate cancer screening and have an abnormal PSA? Ask yourself, if you have an abnormal PSA and or if you have an abnormality found on a digital rectal exam, would you want to be treated if you have been found to have prostate cancer? How do you feel about the risk of being treated for prostate cancer when that is reviewed with you by your doctor? How do you feel about getting a serious or even deadly form of prostate cancer if you decide not to get screened? That is a big question. And so these are things you should consider when you're thinking about getting prostate cancer screening or any type of cancer screening. Ask yourself these questions before getting tested. And so I do have a few informational slides to give to you. I mentioned an organization called Zero Prostate Cancer. You can go on their website. They are a great resource about prostate cancer and Black men. They have a lot of resources and community support. That's one organization. Also, the Prostate Cancer Foundation, I mentioned them, pcf.org. They have lots of information on their website, a lot of community programs as well. Montel Jordan is one of their community ambassadors. And also another organization, the Prostate Health Education Network, prostatehealthed.org. They have a lot of information. And as you can see on this, their homepage, they also have information about clinical trials. And for people who have been diagnosed with prostate cancer or any type of cancer, I always encourage men to look for clinical trials. You can go on clinicaltrials.gov and look for different clinical trials that may be that you can be a part of if you have prostate cancer. A lot of clinical trials may be available, and clinical trials often they're free. A lot of the treatments are very helpful, and I encourage people to be involved in clinical trials because especially Black people, because we are using these medicines. So our genetic makeup and DNA and our bodies need to be involved in these trials because we are using these medicines, so we need to be a part of these trials, and because we are in the market when these drugs come to market. And so with that, I will stop, and thank you for your attention.
If I knew how to, just a second, if I knew how to clap and applaud and do all that stuff and be heard globally, I just want to share for your information. First of all, you let tonight's audience off easy. You let them off easy, and I'm not sure how I feel about that. I don't know that if over time you've watered down your drinks, uh, and I'm talking about natural drinks, because the first time I heard this presentation, and almost 1,100 men saw it. I didn't think men could be that squeamish. But yet it's so massively important, the information that you shared. And I wrote a note that basically talked about clinical trials, how important it was for people in our community to be a part of clinical trials, and were they safe. And there's this notion that people have in the back of their mind immediately. They think about the Tuskegee experiments, and we know that there were many other experiments on people of the diaspora in the Caribbean. Um, but just if you can tap in a little bit more, and give us some why the import of clinical why there's such importance in clinical trials.
Well, like I said, African Americans, so we're just speaking of in the United States, we take medications. We are consumers of medications. And so we need to be involved in the trials in the human beings who these medications are tried in the phase 3 part of the clinical trial. So phase 3 is when they are tried on humans, because we need our DNA, our physical makeup needs to be in these trials, because our makeup needs to be in that data, and needs to be evaluated. So when these drugs come to market, our data needs to be included, because we're taking these medications. And the reason why that's important, because a lot of times we can use that data, can be used to say this medicine is great for African Americans, or the opposite. This medicine is not great for African Americans, but it's better for this group of people. And the great example, there are particular blood pressure medicines that we found out were better for African Americans than other blood pressure medications. And so that's just a great example of why we need to be in these clinical trials. And then clinical trials, you can participate in clinical trials not just when you have a disease. You can be a control. You can be a healthy control, meaning you don't have the disease, but you can just be a control participant compared to the person who has the disease, which means that there are certain clinical trials where you are the control and you're not even taking the medicine being studied, but you're just a comparison to the person who has the disease and who is taking the medication being studied. So there's a lot of different ways to be involved in a clinical trial, and we need to have more African Americans in all types of clinical trials, because one day you may need a medication and we need more people like us being studied for the medications that we may need to take someday.